Does everybody know that we have access for the clients to go on to their portal and access their billing, their claims, and all that with at least 3 of the top carriers, Aetna, Mutual, Cigna? If you don't, they're on our client information document that we share, and you can see how to do that. It's also in the packet on the carrier information that we send to the people. Like, for instance, with Aetna, how they can go on there and create their own login. Were we still helping people with this Cigna one by doing it? I know we haven't written Cigna in a little bit, no. But for the
themselves and the Cigna one, it technically is not required to be available until the policy starts.
Oh yeah, okay.
So sometimes they can log in before then, and sometimes it doesn't work, and we call Cigna, and they say, well, their policy hasn't started yet. So.
Yeah, that's some frustration.
And it was Cigna or Humana, because Humana has one too, but one of them was down for like 6 months.
Oh, that's nice.
I think it was.
Cigna starts selling in California on the 24th of this month. I'm really hoping. Actually, Liz, you saw that first, right? Wait, was it you?
No, it's me.
It was you.
Yeah.
What did you see? Were they competitive, lined up with everybody?
Very competitive.
Very competitive.
But Cigna does a really good job in California. That's one state that...
They're switching from Loyal to Cigna Health and Life. Okay,
Yeah.
good. So now we have another choice besides Blue Shield. That's going to be good. So that's going to come in just a couple of weeks. There's kind of a weird thing where right now we can't write Loyal and we can't write the other until the 24th of this month. The communication on that was quite bad. General information for someone who, let me give you a scenario. They signed up in, let's see, what are we in? August right now. So let's say in May, they were brand new to Medicare. They were turning 65, let's say, and they, right out of the chute, they went with Humana. For whatever reason, they didn't like their experience, not only with the e-app and the signature, but with customer service, whatever it is. And then they call us and they say, you know what, I did this on my own. I want you to help me. Who's the best carrier to go to? Now we have an opportunity for a second bite at the apple. They're still in open enrollment. Do we need to ask them health questions? No, we don't. So whether they're brand new to Medicare due to turning 65 or starting Part B, having left an employer plan, it may be their second Medicare plan. Talking about the supplement world. With Advantage, it's a whole different route. We have to go through trial right and all that. That's a big pain. But on Medicare Supplement, if they're still within 6 months, we don't have to ask them any health questions still, as long as we can do the enrollment within that 6-month window, because they're still in open enrollment. They can change their mind during that open enrollment as many times as they want to on the Med Sup. On the Part D, they cannot. They have one shot when they're in open enrollment. So we can't help them with their Part D plan because that falls into the whole Medicare Advantage world, and that's tricky. But on Medicare Supplement, as many different carriers as they want to go through, still no health questions required. On Mutual of Omaha and GPM, we found the reason why some people were not getting ID cards. It was going back to the application. So on the application, when we're writing Mutual of Omaha and GPM, we have to check the box from no to yes on a drop-down that we want a temporary ID card to go to that person. If we don't, it doesn't go. Also on Mutual of Omaha and GPM, I want you to strongly consider when we're submitting those applications that we, at the very end, when it gives us the authorization number and it says you can have your client go to signyoureapp.com, maybe we should do that then rather than wait for the SMTP server and the spam filter and all that kind of stuff. Like, do you see the email? Do you see the email? Is it there yet? Is it there yet? Is it there yet? How about instead we say, okay, go to your browser and go to signyoureapp.com. We can spell it all out for them. All they need is their authorization number, their date of birth, and they can instantly do that without waiting for any email. 10 years ago, Mutual of Omaha did a webinar talking about e-apps, and they were the only ones doing it back then. And they said that 30% of the time, something around there, agents would think that once the agent was done and they submitted it, it was all over with. It wasn't, because the client had to get that email and they got lost. So if we can continue that's repetitious, continue the continuity of the sale. The whole thing is, okay, now it's your turn. The ball's in your court. I need you to go onto this website. Here's the authorization number. Then we can literally get off that call knowing that everything's been done. And it would save 1, 2, or 3 minutes from having them wait for the email, search for the email, and click it and all that kind of stuff. So just consider making that your process with Mutual. It just makes it a lot faster and smoother. We're going to start going on the admin side to the online portals for approvals, like with Aetna, and you can see it in the enrollment tracker when it's actually approved. We don't have to wait for emails now of telling you officially it's approved. That's going to save us 24 hours at least. So if you see it's approved, then it's approved. We're going to have more information on that in a specific admin meeting coming up, but it's going to speed up our approvals, especially toward the end of the month when it gets kind of chaotic. Computers. With this big new update that Windows 10 did, there's one thing that makes it really weird, and that is with Windows, if you put it in standby mode or if you just restart your computer, either one of those, it's going to save a whole bunch of temporary files to your computer so that when you come back alive, it's going to pull those temporary files and start right back where you were. A lot of these programs that people use are RAM hogs, and they take up your temporary memory in your computer so much so that eventually things start crashing, especially if you have multiple tabs open, like with Google, you have like 40 tabs open and things. So if you restart your computer, this is a weird thing about the new Windows 10. If you restart your computer, it does not clear all those temporary things out, because it saves them to a temporary file, comes back up, and some of those things might still be there. So the best thing to do, and what we should do every single day, is completely shut down your computer, let it sit for a second, and then turn it all the way back on, not restart. And it's been some really good advice. I've been trying that lately, running out of memory, doing video editing and stuff, and I find that it actually does help if you completely shut it down and then bring it back rather than restart or going to sleep or hibernation mode or whatever. And if you're walking around and you're seeing computers are blinking at night, that's because they're not completely shut down. They're in hibernation mode or sleeping. And so it'd be really good if you just completely shut those down. And one last thing, on the weekends, like we want to shut down our computers completely, and that you can't rely on advanced system care to do our shutdown routine and then, lock the screen and then have it shut down, because a lot of times it won't. And what that does is it runs the hard drive and it runs the fans, and each computer component has this thing called mean time before failure, and that is that every component will eventually fail, and the average time in which it takes that component to fail is a set number. And so that hard drive will fail, the fan will fail, the power supply will fail at some point in the future. So there's really no reason why we should leave on a Friday, come back on a Monday, and all of that's been churning all weekend long. So to make things run better and last longer, if we can make sure before we leave the office that that thing's completely shut down, not just the monitors, and not just thinking that advanced system care will do it. It takes just a minute. Maybe we need to start just a couple minutes before, let the system care thing do its thing and make sure that's fixed automatically, and then completely shut down. And make sure it doesn't hang when it's trying to shut down. Like sometimes it'll say, one program's running, are you sure? Are you sure? We talk about wanting to make a difference here. I want to share with y'all one thing that we collectively as an office did when this coronavirus thing was spiking. Remember early on March and April, it was really, really bad in New York, and they had like the highest number of the whole country, and people were freaking out and people couldn't leave their apartments, and so that was kind of crazy. So what we did is, anybody hear of this field hospital that was set up in, what's the park called? Big famous Central Park. Yeah, there was this field hospital set up by a nonprofit organization called Samaritan's Purse. It's run by Billy Graham's son, Franklin Graham. And they set up this field hospital to help people with the COVID because all the hospitals were overwhelmed. And then when this field hospital was no longer needed, they took over 100 doctors and they put them in Mount Sinai on the floor that they had created just for the COVID thing. So we sent them 10 grand during the beginning of this thing, and that really helped them out a lot. And then we also sent 5,000, which was matched by Darius Rucker, our local hometown hero. So that turned into 10,000 for the Low Country Food Bank to help all the restaurant workers that were out of work and stuff. I want y'all to be on the lookout for things that can help other people, whether it's nationwide or in the community or in your family or wherever we can help people, because I think what we should do is continually look for opportunities to give back and help, especially when our community is in crisis, like the food workers that we like to enjoy going and seeing them. And I'm sure hoping that this doesn't happen again where they have to lock down. But who knows? And if it does, hopefully we can do something for them. I know, gosh, probably all of us, most all of us in this room have worked in food and bev before. And it takes a very special temperament and skill and patience level to do that. And when there were tens of thousands of those folks that were unemployed, that really hurt a lot to everybody. Each other, I am so amazed, and thank you all so much for stepping up last week and for helping each other out and for filling the gap and for helping answer questions and making yourselves available. Can't tell you how much I appreciate that, and Nicole appreciates that. We were so happy to have ended the day on Friday in such a totally different place than Monday morning at 8 o'clock. And it's all because of your attitudes and your hearts, and we really appreciate that. So we'll go forward continuing to improve things. I will be available. It's just not physically here, but watching everything. And if I miss something that comes in there, again, you all have my cell phone number. You can text me, and that comes, to the top of the things. But I'll have everything, and I'll be back on Friday at some point after we get her to the doctor the last time, Friday morning. So we're making a difference, folks, little by little, and in different places. We want to continue to do more of that. So keep doing what you're doing. Thank you for being here. That's all I know. Thanks, y'all.